Hey, everybody.
Hey, how you guys doing this evening? Welcome to Get to the Root. I was going to say hit live volume, but it's not. This is Get to the Root, Health and Wellness. Welcome, everybody, to another episode of our Healthy Habits, Healthy Life. And hey, like we promised, it's going to be a great evening because we have a magnificent guest. We have one of the best doctors, I'm telling you, in the continental United States. You best believe it, So definitely, if you're here to join us this evening, it's going to be totally awesome. So, hey, you got a few seconds. Invite somebody, okay? Invite somebody. You definitely do not want to miss what we're going to be bringing you this evening. I'm telling you. So, what do you got, Queen?
I just appreciate y'all joining in with us live again. We're Will and Faith with Get to the Root, where we love to come and share and inspire and motivate you to live a healthy life, to make healthy choices, to create healthy habits, to create that healthy life that you are worthy of living.
Absolutely.
And tonight we will be sharing some, actually we won't, we have a special guest speaker, but we love to come and do healthy habits, healthy life talks where we can share news with you that you can use, that you can apply to your everyday living to help you create that healthy lifestyle that you're worthy of. So our guest tonight is Dr. Kim Scheuer. I'm so excited that she has chosen to join in with us tonight. She is board certified in both family practice and lifestyle medicine. She is conversant in Spanish and American Sign Language. She is licensed to see patients in over 20 states. And we'll be sharing with you all later how you can connect with Dr. Kim and allow her to become your doctor as well. She practices telemedicine at Plant-Based Telehealth, started Doc's Lifestyle Medicine, and has facilitated complete health improvement program CHIP courses. Dr. Kim lives and benefits from the lifestyle that she recommends to her patients.
Absolutely.
That's what I love most about her. All right. She practices what she preaches. She loves to share what she has learned with all who wants to be healthier and happier. So everyone, please give Dr. Kim a warm welcome. Wait a minute now. I got her take the solo off. We got it. Hey,
hi, everybody. So good to be back.
We appreciate you joining us tonight. And I'm super excited about your topic tonight. About fiber. So again, we appreciate you, and we're going to give Dr. Kim the floor because y'all know I always say time is money. So we respect Dr. Kim's time. We respect everyone that's joining us live. We respect your time. So we're going to allow Dr. Kim to go ahead on and share her information with us. And then we'll come back at the end and she'll be, you'll be open to answering any questions. Is that correct, Dr. Kim?
Absolutely.
Awesome.
Hey,
well, we're going to go.
Hey, Jody. Hey, everybody.
Let's say hi to some of our Get to the Root family.
Yay.
Miss Tiffany, all the way from Dallas, Texas. How you doing, Tiffany? Thank you for joining us. What did Tiffany say? Love these healthy life talks. Love Dr. Kim.
Well, thank you.
Yeah, I hope you love us too, Tiffany. No, just picking. It's all good. It's all good. We have Jody. Thank you for joining us, Jody.
Hey, Jody.
Yes, we appreciate you joining us. Thank you so much.
For joining
we appreciate you. And we have Karen. That was all our Facebook family. We also have Karen on YouTube. Got to be live today. Greetings from Oregon. Well, hello there, Karen.
Hey, Karen.
Thank you for joining us. Yes, and we have Patricia Mazzola.
Hey,
thank you.
Patricia.
We appreciate you, Patricia. Y'all go ahead on, hit the like button, hit the share button, okay? Get the word out. Tell everybody tune in to Dr. Kim. All right.
Kim is here.
So,
all right.
The doctor's in the house.
All right, let's do it. I'm going to try and share my screen. Let's hope it works.
Yes, it will.
Right. We hope so. We tried.
It will work.
So,
yay.
Okay, so now I'm going to go in here and talk about the facts of fiber. Now, I can't hear you guys. I can't see you guys. So I'm going to keep talking. If you need to interrupt me, please do. But if not, save up your questions. I'll answer them later. Okay. And Tiffany, I just got my Texas license, just to let you know. But anyways, so I'm going to talk about fiber because fiber is our friend. All right, so what is fiber? What I'm talking about is dietary fiber, okay? And that comes in plants, and it's only in plants. So animals have bones that hold them up, where plants have, you know, they stay strong. That's fiber holding them up. That's the part of the plant that holds them up that we can't digest. It goes through our stomach and our small intestine, mostly undigested. And then it goes into our large intestine, where it's actually food for our microbiome, our gut microbiome, which is a huge amount of bacteria and other things in our large intestine that protect us. And then most of it's pooped out. So what's nice about eating plants is it kind of scrubs our intestines and then poops out, and it's great. We don't absorb it. But there are different kinds of fibers. So there's soluble fiber, which generally you can think of as it dissolves in water, and it works by forming a thick gel in water. And that is broken down by the good bacteria in the colon, in the large intestine, and keeps our bowel wall healthy and strong. We don't want to have something called leaky gut. And I'll show you more about that later. So that keeps us strong. It also helps lower cholesterol. So it pulls out things. It pulls out cholesterol and toxins from our body, and then we can poop them out. And so examples are oats and barley and psyllium and flaxseed and beans and lentils and soy and fruit and things like that. Insoluble fiber is the fiber that doesn't dissolve in water. It works by increasing our ability to draw water into the stools. It makes the stools larger, but softer, so they're easier to pass. You know how if you're constipated, you've got those little pellets? It's because you're not pulling water out into your intestine, and that's because you don't have enough of the insoluble fiber, which adds bulk to the feces, and that's whole grains like rices and rice brands. So white rice wouldn't have that. You want to have the outside of the rice bran on there. Veggies, nuts, and seeds are insoluble fibers, and they're great. Then you have something called resistant starches. That's part of the food that isn't really fiber, but it acts like a fiber. So that's a part of the starchy food that resists digestion in the stomach and the small intestine, and it helps form short chain fatty acids, which are really important in the large bowel, and that's done by fermentation. And it's important to bowel health, to cancer prevention, to decreasing cholesterol. That's found in lentils and baked beans and actually potatoes. When you cook them and then you cool them, and then you cook and then you heat them again and cool them again and heat them again and cool them again. You know, when you're doing leftovers, that's more resistant starch, and it's great for us. And again, the rice and the pastas can be resistant starches, which are really helpful. Here's another way of looking at it. You've got the soluble fibers, which are gel forming. They regulate sugar, increase satiety, so it means you're full more. So the more fiber you have, the fuller you feel, and you're not craving food all the time. It has heart disease benefit. It regulates transit time, so you can move it better. And there's lots of studies out there that the more you move your bowels, the less toxins you reabsorb. It lubricates your stool. And it's great. Then there's the bulk fibers on the other side, which are insoluble. Again, speed up the transit time, regulate your glucose, bulks and softens the stools. And then the fermentable, not really fibers, but starches, resistant starches, which work in fermentation in the large intestine to regulate your blood glucose and increases the healthy number of bacteria in there, your microbiome that's healthy, because you can have an unhealthy microbiome, you can have a healthy one. In general, high fiber diets improve digestion, stabilize blood sugars, detoxify us, so pull things out and help our liver and kidneys detoxify us, feed our good gut bacteria, and really we're just host to the trillion good bacteria that are in there. We just carry them around. They're way more than the number of cells we have in our body. And it scrubs our colon and our arteries and gets rid of the cholesterol and gets us clean. It's kind of like a pipe in your sink. You need to scrub it out every once in a while so it doesn't get clogged. So remember I was talking about the gut, So the gut has, I don't know if I can't do that. So if you look at where it says on the top one, it says protective microbiota, which is all the 3 trillion or trillions of microbiome, bacteria and things that protect us. And then that is a layer that protects the one layer of cells that is that protects our inside from our outside. So you can think of your gut as basically your skin on the inside. So your skin protects us from having stuff go through it and having toxins go in, same as the gut. It helps us protect us. But if you look, if the protective microbiota are not there, then you get invasive pathogens, which go where that M cell is and the antigen is, and you get inflammation, the IgA goes out, you lose that tight junction. So you're not having, you're having that leaky gut, and things go in that shouldn't go in. And they don't go through the cells like they should. They go around the cells, and that gets us allergic. It gets us cancer. It gets us cholesterol buildup. It's bad. And the bottom talks about we need a very healthy, balanced gut microbiome. We need the healthy stuff instead of the non-healthy stuff, which if we have more of the healthy, we don't get sick. We don't get infections as much. We don't get diarrhea. We don't get anything else. So if the harmful is too much, we get a lot of gut permeability. We get diarrhea, we get diabetes, we get obesity, liver cancer, liver diseases, heart diseases, and we get sicker. And there's a lot of that good, healthy microbiota also affects serotonin, inflammation, and all that. So the fiber is what feeds that microbiome. If you don't feed them, they die off and you get the invasive pathogens. So dietary fiber, this is a more complicated one, which I showed last time a little bit, but it fosters the beneficial bacteria, which then, if we eat that, it affects the gut bacteria, the barrier, the immune system, the endocrine system, detoxifies our organs. And so it will send off all kinds of the short chain fatty acids to help the gut function. It reduces the burden on the kidney because it helps the kidney filter, and it reduces the burden on the liver because it helps that filter. If you don't have dietary fiber, all those things go wrong. All those pathways can get in trouble, and you can, get too much cholesterol, too much inflammation, etc. So what exactly does that mean? Like for cholesterol, if you increase 10 grams of soluble fiber a day without medications, you can decrease your LDL, which is your bad cholesterol, 22 points. So any medicine does, if you can be put on Lipitor or a statin, which can do that, but then you have the side effects. If you have fiber, if you increase your fiber, you take that down without any of that, no side effects, and it not only affects your cholesterol, but heart disease. So if you increase your fiber 10 grams per day, you can decrease your coronary heart disease death. So that's heart attacks, things like that, 24%. By 10 grams of fiber a day. So you increase all kinds of coronary heart disease, and they're talking about cholesterol buildup in your vessels. They're talking about heart attacks. It infects strokes the same way. 7 grams of fiber per day, and these are all from some of the from multiple studies and How Not to Die book, which is a great book by Dr. Greger. So read that if you haven't read it. If you increase 7 grams of fiber a day, you decrease your stroke risk 7%. You increase fiber, you improve insulin sensitivity. You increase fiber, decreases your hunger and decreases your weight. You increase your food bulk without increasing calories. And we all eat, 4 to 6 pounds of food a day. But if you're eating 4 to 6 pounds of Milky Ways, my old favorite, you're going to gain a lot of weight because there's no fiber in there. There's no water in there. There's no nutrients in there. You eat 4 to 6 pounds of salad or fruit or veggies or anything like that, you're going to be so much fuller, and you're going to lose weight because you poop out more. You actually poop more, which is great. Breast cancer, increasing fiber to 25 to 40 grams a day decreases circulating estrogen, which causes breast cancer and can decrease breast cancer 8%. And we want estrogen, but we don't want too much. And so increasing your fiber will help that. Colon cancer. If you increase your fiber, your colon cancer risk decreases exponentially. And it also affects depression, irritable bowel disease, inflammatory diseases, all kinds like arthritis, things like that. They found that you increase fiber, dementia goes down, constipation, fertility improves. It binds toxins, flushes them away, including things like lead or mercury. I have a lot of people come to me and say, I need to do detoxification. Well, no, increase your fiber and it automatically does that. So how much do we really need? Because, I was talking about how much we should get. Fiber, most people on the standard American diet get about 10 to 15 grams of fiber a day. When we evolved a long time ago, we used to eat about 100 grams a day. And it's that we still find in some primitive societies where but the average American eats less than 15 grams. And officially children need 19 grams a day. A 4-year-old, that's 1 to 3 years old. 4-year-olds need 25 grams a day. Teen boys need 38 grams, men 38, and women 25. But actually, I think that's for the standard Americans. That's what they suggest for standard Americans. If you eat more, you're going to even be healthier. And so to do that, obviously it's eating veggies and legumes and fruits and anything that's plant-based. Those with the healthiest gut microbiomes eat 30 different plants a week. I was counting my breakfast yesterday and I put it on Instagram. I think I had 14 different foods in my breakfast bowl for one breakfast. So I'm well on the way to that and I feel great. And so the optimal diet is, between 35 and 50 grams of fiber a day. And I would say over 40 grams would be optimal for everyone, except for babies. You got to be careful on that. But with adults and growing teens, as much as you can. What happens on the standard American diet with not enough fiber, you get hard, small stools. Oh, and I forgot to bring my cup. I had a cup to show you. I forgot to bring it. Sorry. But hard, small stools, and the stool weight's small. So there's a thing that says the smaller the stool, the less weight, the bigger the hospital. And the bigger the stool, the smaller the hospital. I used to think that going to poop I know this is terrible, but going to have a bowel movement every couple of days was fine. But now it's every day and it's several times a day. And it's better for myself because I have breast cancer in the family and colon cancer. So I now feel so much more comfortable. Plus transit time, how much time it takes for your food to get out of your body makes a difference. If you're on a standard American diet, it's many, many days. And constipation is common. And even if you don't feel constipated, if you're not pooping every day, you're probably constipated. Whereas the optimal diet, you got soft, large, heavier stools. You're going daily, at least once, probably 2 to 3 times. In my house, we talk about the fact that we need a bigger septic tank because we poop a lot. And transit time's really quick. And a great way to check your transit time is eat a beet. And if you eat the beet and within 24 hours you got a reddish stool, that's what you got. That's the transit time. And constipation is very rare in people who have a whole food plant-based diet and get enough exercise and get enough fluids. So how do we know, what's what? You can look at charts and you can see, half a split pea has 8 grams and all that. So there's lots of charts out there and you can look at that. You can also go to Physicians Committee for Responsible Medicine and download this Power Plate Fill Up on Fiber checklist. So you just write down your food, write down your fiber score, and see how much you get every day. If you're less than 20, you need more food fiber in your diet. If you're between 20 and 40, you're doing better than most people, but you still can bring more fiber in your diet. And if you're over 40, yahoo. And sometimes I joke that I get 40 grams for breakfast. I don't quite, but I try and make sure I get as much fiber as I can. So a couple things to do is labels and fiber. You got to read the label and see what the serving size is, then look at the total number of carbs per serving. And under that, look for fiber. So if you look here on this, the one, I can't show you, the one that says 110 calories and it has bigger, it says, first of all, that this has 130 sodium. So it's too much sodium for that piece of bread. If your sodium is more than, your salt is more than your calories, it's too much. Not bad, but too much. But then you look at the dietary fiber and it says 8% of your daily fiber. And they're talking about low dose, the lower end. But the dietary fiber is 2 grams, where the total carbohydrates is 21. Well, if you multiply that 2 by 5, you get 10. There's less fiber than carbohydrates. That's not good enough. Look at the next one over that has 50 calories per slice, okay? And again, a little bit too much salt. Oh, no, yeah. A little too much salt because it has 115 sodium. But the fiber, you have 5 grams of fiber with 10 grams of carbohydrates. So 5 times 5 is 25. Actually, you're getting much more fiber in that one. So the fiber in that one's better, okay? So that's really one way to look at that. Just multiply it by 5, and if it's more than the total carbs, that's great. And you want, again, that's one way to look at it if you're looking at a label. And then, oh, shoot, I thought I had something else. I thought I had another slide, but I don't. So supplements. What about supplements? And so remember I talked about dietary fiber, not supplements. There's only 5% of this whole country gets the recommended level of dietary fiber, but it does, using supplements does not provide the health benefits that their dietary fiber generally does. Fiber needs to gel to keep your patients well, in one study it said. And so if you're taking fiber supplements and medications, the supplements aren't quite as good as the food. So take the food if you can. Some people need a little extra supplement. If they do, that's when you talk to your doctor. But if you're taking supplements and medications, don't take them together because there's drug interactions, and the fiber in the supplements decreases the absorption of calcium, zinc, and magnesium, which are really important. And again, you need to have plenty of water. You need to have so much, you take a supplement in 8 ounces of water, and then make sure you have 2 liters of water, 2 liters of water a day if you're doing a supplement. But again, I don't want that. I want you to get it in your food, because with the food, fiber in the food, it has a lot of other things attached to it, and it makes it, you want the whole package. So how do we increase it? Here's some easy ways, okay? If you had cornflakes, you get less than 1 gram of fiber. You have oatmeal, that's 4 grams of fiber. But you have oatmeal with raspberries, half a cup, then you have 8 grams of fiber. You have oatmeal with raspberries and ground flax seeds, you got 10 grams of fiber, plus more nutrients and everything like that. So I end up in my breakfast adding so much stuff that I end up with a lot of fiber, because I got my oatmeal, I have my oat groats, which are even more fiber. I have tons of fruit on there. I have some greens on there. It's kind of weird, but I do. I have some beans on there because I like to get my my soy in for protecting of breast cancer, and I don't taste it when I'm having my breakfast with that. And then I get my flax seeds, etc. So I even have more than 10 grams of fiber on there. For lunch, a cheeseburger, which you shouldn't be eating for so many reasons, you get 1 gram of fiber. And why? Because of the bun, not because of the cheeseburger. Remember, meat and cheese don't have fiber. So some of the grains in the bun have it. But switch it to a tofu veggie burger. You got the tofu, you got the veggies, you got 4 grams of fiber. Switch it to a tofu veggie burger with some salad and a mixed grain, a mixed grain bun, you got 7 grams. Dinner, you got spaghetti, 1 cup with tomato sauce, 5 grams of fiber. But you take that spaghetti, you make it whole grain spaghetti and some tomato sauce, you got 9 grams of fiber just by changing from whole, the regular spaghetti to whole wheat spaghetti. And then, and I should have said wheat, not meal. Sorry about that. And then whole wheat spaghetti with tomato sauce and lentils for lentil bowls, or, instead of like the meat, meats, ground meat, it makes great flavor. You get 16 grams of fiber. Add some more veggies and some other stuff in there, you get more grams. So as you can see on the side, navy beans have a lot of fiber per cup. Avocados have fiber. Chia seeds have fiber. Acorn squash. You can find lots of things that you can add that have a lot of good fiber for you. So I just add as much plants as I can to every meal, and I'll get my fiber in. But what about gas? Because fiber, when people change from a standard American diet to a plant-based diet, you're messing around with your microbiome. The microbiome that was there that loved the meat is mad. Where's my food? And so it gets mad at the good, healthy microbiome that's getting fed better. So there's a little bit of a war there when you first go over. And you can feel bloated and gassy. Many people do after eating beans or things like that. It takes a while for your gastrointestinal system to get used to the extra fiber. So give it time. Give it to a couple, 10 to 14 days, but also go low and slow. So if you're going to add stuff in, instead of adding a whole big bowl of beans, add a tablespoon. See how you do with that. But lentils, soy products, and peas, which are all legume, all in that bean category, they tend to cause less gas. So you might want to start with those, like cooked lentils and peas and soy products. They tend to cause less gas. Go low and slow and just bring it up slowly, and you should be fine. But it also does help to live with another plant-based eater, because we're used to each other's parts. But here's a shopper's guide to the top 55 fiber foods, and you can see it's all fruits, vegetables, beans, peas, greens, nuts, and seeds. And you can just mix them all up and have a great meal. I mean, just look at all that. It looks delicious. If thinking about putting a bowl of brown rice or some millet or some oats or some quinoa, and then having some, veggies on top with some greens and some nuts and seeds, and then have a dessert of apples and berries, or kiwi or things like that. So it's nice. You can always do that. Again, you can take control of your own health. There's nutrition, there's activity, there's avoiding toxins, adequate sleep, stress reduction, relationships, time outside, purpose, having a joy in life. Those are all really important pillars, but nutrition's really big, and the fiber helps you do all of that. So live the lifestyle that I live the lifestyle I prescribe, and you can see my food in there has a ton of fiber. I have fruit and veggies and salad in there on my pile of food. That's actually that pile of food on the bottom under near nutrition is my typical lunch and breakfast for when I work. And I am only 5 feet and, only like just over 100 pounds, where I used to be 150 pounds and ate a whole lot less. So it's so nice that I can eat as much as I want and not gain weight. But don't forget the rest of the stuff. And come visit me at any time at Plant-Based Telehealth. And I got to put Texas on there. I didn't even put Texas because I just got that. And I'm going to stop sharing and hopefully get back to you guys for questions.
All right.
Yeah.
That was excellent information, Dr. Kim. So
Yes.
You're in Texas now.
That's awesome.
Yes, I am. I just got into Texas.
Awesome. That is amazing. How, back in the day we used to say, let your fingers do the walking. Well, now you can let the internet do the walking and connect you with the world.
It is so awesome.
Yes, I think that's amazing. So I'm going to add that to this crawler down here that Dr. Kim is now seeing patients in Texas.
Yes.
Okay. So we did have some questions, Dr. Kim.
Okay.
So I'm going to give you the floor, and we're going to pull up some of the questions that we had. All right. So Jody Rose.
Yeah.
Is there such a thing as too much fiber?
Well, Jody, that's a great question. And I have had plenty of my patients come to me. We change them to a plant-based diet, but then they're also taking the supplements too. And yes, if you're doing that, there's too much fiber. No question. Also, if you are not doing enough fluids, then you can have too much fiber because you can get stuck in there because you're not getting it out. If you're not moving, you can have too much fiber because if you have to move to get your gut to do something called peristalsis, which is squeeze the poop out. So if you've got so much fiber in there from supplements added to a healthy diet, from not moving or not having enough liquid water to push it out, I just realized I have ink on my fingers, then you can have too much fiber. And everybody is different in a way, so I wouldn't, go with a little bit of what your body says. Again, go low and slow and take what you need. I eat a ton. And remember that we were meant to eat over about 100 grams. There's no way in our society these days that we're going to eat that much fiber. So it's not likely you'll get too much fiber by just eating healthy foods. I hope that answers that.
Good. Awesome. All right, Misty Blue.
Oh, good question.
Gut diagnosed?
Well, there's a couple of ways. One is, so there are some tests you can do, some breath tests that can check for SIBO, which is, I'm blanking on what SIBO is. It's small intestine bacterial overgrowth, because the bacteria is supposed to be in the large intestine, not in the small intestine. And so if you have too much bacteria that grows up and moves into the small intestine, you can check that by doing a breath test. And it tests, so you have to swallow something and then breathe, and it sees what kind of bacteria is where. Leaky gut is mostly by your symptoms. It's mostly diagnosed by symptoms. Colonoscopies and things like that, you can do a biopsy, but what you're doing with biopsies are really seeing if there's breaks, like for Crohn's disease or inflammatory bowel disease, things like that. So you could do a colonoscopy and do biopsies and things like that, but mostly leaky gut is really a symptomatic diagnosis.
Awesome. Okay. All right. Mr. Blue again. I can easily get 60 to 90 grams. Is that too much?
How you feel? As long as you're feeling good, that's not too much. I think it's great. And I think I'm with you too. I love eating that much fiber because remember, with fiber, it's not digested. So if you eat it and you have a lot, you'll poop it out. And that's great because that decreases your risk of colon cancer significantly, your risk of breast cancer significantly. You're not reabsorbing those toxins. You're pooping out the toxins on top of the fiber because it's grabbing it and pulling it out. So it's great. So no, I think it's awesome. I think it's awesome what you're eating.
That's awesome.
Great.
Tiffany.
Yes.
30 different plants the other day. The minimum goal is always 15 different plants in my daily salad. That is awesome. Awesome.
I love it. That's awesome. Yes. And that's what I try to do too. I try to add more, like if I'm having anything, I'm like, what else can I put in here? Which is so different than when I used to limit what I ate. Because I was overweight and I used to limit. And now it's like, what can I have? What can I add on? What will be good? And I try and do, you guys know, there's two things. I like the G bombs, which is, you guys know about the G bombs. It's Dr. Furman talks about that. Yeah. Beans, onions, mushrooms, berries, nuts and seeds. So I try to add those in, make sure I have as much as I can of that, because those are all in their own right. Each one of those things are cancer preventing. Yeah. And then I love Dr. Greger's Daily Dozen. Yes. And so I try and get the Daily Dozen in. And so I'll add things on. If I'm having a salad, I'm like, what else can I put on there? To make it even more healthy. And it's great. So that's what I do.
Yes. Awesome. All right. We got another question.
Okay, go for it. What's my favorite type of bowl meal? Okay. So again, I like to have a lot of things in the mix. So I will batch cook every week. I'll batch cook a big pot of, I put red rice, farro, brown rice, and sometimes if I have another grain, I'll put it in there. All together, put it in my Instapot, press the button on manual, and then 30 minutes later, or 40 minutes later, I've got my food, and I just batch it, put it into the fridge. And then I also batch cook a pile of oat groats, usually some barley and some millet in that one. So I have 3 different grains in the 3 different grains. And so then, the breakfast, my bowl would be a huge bowl of the oat groats with, again, I put leafy greens in everything I have because it's so healthy and it helps your vessels vasodilate. It helps your blood pressure. It helps your heart. It helps your cholesterol. It adds fiber. So I put some greens on there, and then I put lots of fruits. So my favorite breakfast would have, I love blueberries. So it's either mixed berries or blueberries. And then I'll have love mango and pineapple and banana. I'll put the frozen stuff on first, then get that warmed up, put on there banana and flaxseed and cinnamon and whatever I want, there. So that's my favorite breakfast bowl. Next, for dinner or lunch, I'll have the red rice and the brown rice and the farro usually mixed together. And I'll put, let's see, oh my God, I can have it Mexican with some salsa and some nutritional yeast and some broccoli or cauliflower with some, corn or whatever. I'll put that there so I can have it Mexican. Or I can have a peanut sauce that I use. I make my own peanut sauce that has some, you can make a great sauces with white beans in there. And I also, I almost always have tofu, because I've got a family history of breast cancer, and my mom had breast cancer now, my age minus 9 years. So, or 10 years, 10 years. So I'm 10 years past when she had her breast cancer. So I'm like, let's keep me from getting breast cancer is what I want to do. So I always have tofu or beans or something like that, or, edamame on that. And then the other bowl, I'll have like a peanut sauce with more like a Thai peanuts. I love Thai food. So I'll have some Thai basil and some, little corns or little different things that are more Thai-like, with still my broccoli, because I love my cruciferous vegetables, maybe some bok choy, maybe some other stuff. So or I can have an Italian bowl. So you can just change the dressing. Like, I love California balsamic Italian dressing, and I can make it an Italian one with, some grains and a salad. And I always have grains in my salad. That adds more, it adds more bulk, it adds more fiber, and it keeps me lasting longer. If I just have a salad, it's not, even if it's a big salad, I'll eat it and I'll feel full, but then I'll be hungry later. So I put some grains in there to make me, to keep me from getting hungry later. And I'll have some, garbanzo beans with tomatoes and carrots and, all kinds of stuff on there, and make with an Italian balsamic on there. Delicious. So just depends on what kind of, and I love Indian curries, and I love Thai curries. So, I'll have an Indian curry bowl with, all kinds of stuff. So
yes. Isn't it wonderful to talk about your food, and you could just, it takes you to La La Land and bliss, because it's just,
so many people think we eat the same thing all the time. I have such a variety of foods. I mean, there's so much more I can eat than I used to.
It's so true. So true. Now I have a question, because I have a lot of family members and friends. I've heard them talk about diverticulitis.
Yes.
And I can remember being very young at my plant-based walk, and I had a family member that called me, well, I have diverticulitis and I can't eat anything with fiber in it because that's what's making me sick. And I was listening to your presentation, and you were saying pretty much fiber helps reduce inflammation. Now with diverticulitis, that's inflammation of the intestines, right?
So the large intestine. So diverticulitis is, so in your large intestine, say you have a bike tire, right? A little rubber tire for a bike, and you get a weakness in it, you put the air in, and that little weakness bulges out.
Yes.
So that's the same thing in the intestine. It's a weakness in the intestine that bulges out. So that's diverticulosis. That's the bulge. Diverticulitis is when it gets, like a piece of food gets stuck in there or something gets stuck in there and you're inflamed.
Right.
And once it gets inflamed, that's itis. That's inflammation. That's like arthritis. Okay.
Right,
So you have the osis is the little outpouch. The itis is inflammation. How do you get that outpouching? Like with a bike tire. If you have a weak area and you push a lot of air into it, the pressure builds up and that pouch comes out.
Right.
Same thing in the colon. If you are constipated, if you can't put that out, you get pressure back up. You're trying to push out and you push and push and you push pressure on and you get that weakness and it pushes out. So that's diverticulosis. Then you have a risk once you do that of getting diverticulitis, which is something stuck in there getting inflammation. And they used to say if you had diverticulitis, you couldn't have seeds because they thought it would get stuck in there. That's been disproven. Same thing as the fiber. It's disproven. So what happens is when you have an acute attack, you kind of want to slow down things. So you go on a low fiber diet for a couple of days, just a couple of days. And then you start adding the fiber back in. And the more fiber you have, the less likely you're going to have the diverticulosis, the outpouching. If you don't have the outpouching, you're not going to have the itis, the inflammation. You're not going to get sick. So actually the treatment is immediately is to slow down eating anything because you want to let it heal up and go. And then low fiber for a couple of days and then the high fiber. And you gradually increase the fiber. And that's the same thing. You reminded me of something else, which I should have put in my talk. Besides the diverticulitis, there's lots and lots and lots of proof. Higher fiber diets have less diverticulitis. Okay. Once you have the disease, you got to slow down. A lot of people are on the Low Fodmaps diet because they've got issues with their stomach. And that's Low Fodmaps is this long name that I never remember the name of it, but it's, it has to do with the fiber and all that. And so they put you on a low Fodmaps diet. But again, you only want to be on that very short term for a couple of days. And then, but a lot of people think I've got to be on this the rest of my life. And then they get into trouble. So people who stay on those diets get in a lot of trouble. Eventually you want diversity of food. So, and you want to build up, go low and slow to build up. Once you're built up, you're not going to have that problem again.
So if I'm hearing you correctly, the diverticulosis pretty much came from a low fiber diet, not eating enough fiber. Okay.
Exactly.
Okay.
And the constipation that comes from it, the backup, all that stuff, it's all stuck there. So it puts pressure on and then it pops out.
Gotcha.
Okay. And one other thing that I enjoy about living a plant-based lifestyle is everything we eat, if we're eating a whole food plant-based diet, has fiber. And so we're detoxing. Every meal we eat should be like there's no such thing as going on a detox because we have to detox. Yeah, I mean, I've never understood if you're going to detox, then why go back to the junk that got you toxic from the get-go? Why don't you just continue to eat well, some people go extreme and they do the liquid the smoothies and all, it's different types of detoxing, but I prefer eating whole plants and letting everything be full of fiber and it automatically just our bodies does what it needs to do. So
it does. And it's really helpful. I mean, think about food as a medicine. You can put a pill in your body that's either poison or helpful. Food is the same thing. It's the same thing. You're putting the same thing in your body. It's either helpful or harmful. So put only the helpful stuff in. You know, why put in the harmful stuff?
Right.
And then for detoxing, that's why in general, if somebody can't eat or can't chew, maybe they've had mouth surgery, or maybe they've had something that makes it really hard for them to chew or to digest really well. I don't like juice fasts as much because you're taking out the fiber. You're taking out all of the insoluble fiber. And so that limits you. Whereas a smoothie at least has a fiber in now. Now it's broken up in a way that may not be good enough for your gut, but it's better than, from the smoothie, you want to, better. So if you've been sick for a long time, you've been fasted for a long time, you want to go, you want to get back, and you can go first to a little juice for a couple of days, but then you really need to get to the fiber and the smoothie faster, and then to real whole foods if you can. So the best thing is the whole foods.
All right. Well, we have one more fun question, Dr. Kim. I'm going to take us off of here. Let's see. Tiffany. How long is signing? I learned many years ago and need to refresh my skills.
First, watch Coda. You got to watch Coda, the movie. It's so good. You got to watch it. Yeah. I've been signing, a lot of my life. So I grew up, my brother is deaf, but he grew up oral. I went to college. I needed an easy A. And so I took sign language. I came home and I said, "You're deaf. This is awesome." And he's like, no. He was in junior high school and he was short and he was deaf. He's like, "I don't want to be different. I'm not deaf." He was mad at me. He didn't talk for me for 4 days.
Wow.
So I learned it. I loved it. I got into it. I was with deaf people all the time. My roommate was deaf. My landlord was blind, so I was interpreting between them all the time. It was really fun, but it was great. And then I got a master's in deaf education when I was 21, and so I've been signing since then. I used to be fluent in Sri Lankan Sign Language and American Sign Language. I love using it every day, anytime I can. Tiffany, it's awesome. Use it. It's so much fun. I'd love to just talk with you anytime about it.
One more question, Doc, then we're going to let you go. Should we be taking probiotics?
That's a great question. So no, not if you're taking prebiotics. So prebiotics is fiber. Fiber is the food that feeds the gut to make the probiotics that you're trying to take. But if you take the probiotics, most of the probiotics out there, not all, most of them are digested by the acid in the stomach and doesn't even get down to the gut where it needs to be. So probiotics are just supposed to be live organisms that can replace what you got in your gut. But if you feed your gut the prebiotics, your gut microbiome makes its own. It's eating what it needs to, makes its own. Now, there's rare instances when you talk to a doctor and they tell you, yeah, maybe. But really, most of the time, no. Even if you're taking antibiotics, they actually now have research that shows that if you take antibiotics and then we used to say take probiotics after to refix your gut, it actually, the people who do that make themselves worse off. So very limited cases for probiotics. Take the prebiotics, which is the fiber.
Good.
Which is the food that has the fiber.
All right, awesome. Yes. Let me see. Let's see if we have any more comments here, Dr. Kim. We got a lot of comments. Any questions?
I saw somebody who said, "Can diverticulitis be reversed, or diverticulosis be reversed over time, or is it okay?" So, I think it can be improved. I don't know that it can be completely reversed, but it certainly can be improved if you're not constantly putting pressure on that the bicycle tire. It won't get worse. And so that weakness will get a little bit better. And in your gut, our bodies are made to heal. Like if you hit yourself with a hammer and keep hitting yourself with a hammer, it's not going to heal. You stop, it may heal. So I think that, and I'm not 100% sure, I think your gut, I know your gut can heal. Can the outpouches heal? I'm not 100% sure, but they certainly won't get worse. And you certainly have no more risk of the diverticulitis. You have much less risk of diverticulitis. Okay.
That's good information with Dr. Kim. We appreciate you taking time out to educate us on fiber. So
awesome.
If we eat for fiber, we can't go wrong with our health, right?
Yes.
I think so. Well,
I'm just saying, I try to eat.
you know what I'm saying? I want to be the healthiest I am for as long as I can. I want to live as old as I can, die as old as I can, as young as I am, you know, as I can be. So, you know, while you're here, treat your body healthfully and you'll be healthy much longer. My idea is to eat a great bowl of food, have a great day of exercise, fall asleep and not wake up at that time. And I don't know when it'll be.
Yeah.
But that's a whole lot better than spending the last 10 years of my life taking meds, being in the hospital, seeing doctors like me. Try and avoid that.
Yeah.
Eat your apple.
I agree.
Get your fiber and you won't see me.
I know that's right. Well, I appreciate having doctors like you because instead of prescribing pills, which I know you may do, you have to do sometimes, but you're always prescribing food, you know, because food is our medicine. So, and lifestyle. So we appreciate you. We'll thank you taking time out. And again, I'm going to show your contact information. I'm going to hide him, Will. And
it's great to see everybody today. You guys, thank you so much for all you do and for having me on.
Absolutely.
Thank you, Dr. Kim, again. We appreciate all of you all for joining us, leaving all the great dialogue, the comments, the questions. We just appreciate our Get to the Root family joining us on our, what is this? Healthy Habits, Healthy Life number 20. So, and we have thousands more to go. So we appreciate you all. Again, always remember, our health is our wealth, right? So let's get to the root of eating more fiber, eating more plants, stressing less, and loving more. And until next time, we will see you all on Saturday. Saturday morning at 7 a.m. We will be live. That's 7 a.m. Eastern Standard Time.
We ready to go.
We will be live. So until then, continue to take care. We love you all and see you on the next one.